Dr. Elizabeth is in studio. She is joining me for this conversation, and I'd love to let her introduce herself. So, Dr. Elizabeth, thank you so much for joining us for E Squared, and welcome to the show.
Thank you so much, Caroline, for having me here.
Yeah.
So my name is Dr. Elizabeth Joey. I'm a consultant pediatrician and actually work in the government sector. I work at Mama Lucy Kibaki Hospital, which is just next door to here. And being a pediatrician means I take care of children, basically. Ideally, a child is somebody from newborn till they're 18 years old. So anyone, even the adolescents, all that classifies under pediatrics, and we're here to take care of them.
Okay. What do you love about being a pediatrician?
It's fantastic. You know, working with babies are the purest souls, honestly. They are very pure. So, and what I like about babies is that they don't lie. The baby is unwell, they'll show you they're unwell. The baby's getting better, they'll show you they're getting better, and they bounce back really fast. So I'm really passionate about seeing babies thrive healthy. I usually tell people I don't like seeing sick babies, which what most people would want to, to treat the sick. I'm like, I'd rather make sure you remain well.
Okay.
Yeah.
What does it really take to be a pediatrician?
It's actually quite a challenging job because you have to work with little babies, even the older babies, and it's most of the time very painful to see them actually struggling. So you can imagine putting yourself in that situation where I have to do everything I can just to make sure this baby thrives and does well. Yeah. So it's quite a challenging job, but it's also quite a fulfilling job.
Okay.
Yeah.
Okay. So you'll just be holding your mic close to your mouth.
Okay.
Yeah. So Okay. So okay. So today we're going to be talking about taking care of 2 to 6 year old. Wewe ni bazu kwa hiyo sector. So you're going to be teaching us. I'm open to learning.
Yes.
Yeah, so we'll start from the key pointer. When we talk about raising a 2 to 6 year old the right way, what exactly is the right way?
There are quite a number of components that come in terms of raising children, 2 to 6 year olds. One, it's quite a challenging period. That's where you hear talking about terrible twos. That's where you hear talking about tantrums. That's where you hear people telling people that my child is about to go to school, which is also another challenging period. And you find that most of the time, a lot of focus is put on the younger babies. And these older babies kind of sometimes get lost, like even parents know. I take my child to the clinic until they're 9 months or 1.5 until they finish getting their vaccines, and that's it. But it's a very important period in life. Your childhood actually is a very important period in life. Your brain is developing, and it literally is like a sponge at that point. And there are so many factors that can happen within that period that can literally make or break the life of this child. And I think one thing that is important for parents to know is that what we do when we're training these little babies is actually grooming them to the future. I'm not just taking care of a 2-year-old or a 6-year-old. I'm raising a future adult, So whatever I do at this period actually has a very big impact on raising this child. And a number of times you'll find that there's focus on their physical health, but then people forget about their emotional health, their social emotional, bits. What do I need to do to make sure that this child thrives as a whole human being? Okay. Not just a healthy baby, but are you healthy mentally? Are you healthy physically? Are you healthy emotionally? So that's quite a number of the things that we do, like when we're watching them grow and, the things that we need to do to make sure that this period is done well. Okay. It puts you at a very good point now, if you do it well, to what you're going to go through with your preteen, with your teenager, and even with your adult child.
Okay.
Yeah.
Now, as a parent, how do I ensure my 2 to 6 year old is mentally, emotionally, and physically fit?
Okay, there are quite a number of things. Now, it's important to know that these are children who you still have to make sure are growing well. So physical health is very important. So you have to make sure that, one, they're still catching up with their pediatrician's appointments, yeah? Don't stop because it's 18 months and they've gotten their last vaccine according to their schedule. Continue going to your pediatrician. That's also an important thing because that's the point where the pediatrician will also keep monitoring, and we tend to pick very little subtle changes, which if managed adequately and early, can actually be sorted out in the future. So we have to continue going to the doctor's appointments as scheduled, not only when the child is sick. We have this habit, I don't know if it's as Kenyans or as general population, that I go to the hospital when I'm sick. But going to the hospital when you're well, just to make sure, or taking your baby to hospital when you're well, just to make sure your baby is well, makes a very big difference. Preventive medicine is very important.
Okay.
Yes, so you have to make sure that they're going for their physical appointments. You have to make sure that your child is eating well. And this is usually one of the topics that we usually discuss with parents. And a number of times, it brings a lot of questions, maybe issues sometimes, you know. You'll hear people saying, my child doesn't eat. Or you'll tend to just give them what you think is right, or maybe what you didn't have when you're growing up, yeah? So we are causing, as parents, quite a bit of undernutrition. And when I talk about undernutrition, I'm talking about the low weight and the high weight as well, yeah? Obesity is also part of malnutrition. So we have to make sure that our children eat very well. A 2-year-old ideally should eat every 3 hours, yeah? Every child ideally should eat every 3 hours. And when I say every 3 hours, that's 3 main meals with snacks in between. And your 3 main meals and your snacks all have to be well balanced and well nutritious, and also a good quantity. So breakfast, lunch, supper, and your snacks in between. Healthy snacks, not soda and crisps and lollipops and things like those. No, healthy snacks in between. A glass of milk, a cup of yogurt, fruit, very essential. And children also eat vegetables. People don't believe that, but it's very important. Introduce different kinds of foods to your children at an early age. They get used, you prime their taste buds. They get used to eating all of these things. Mboga is essential. Whatever, parents will always tell you, mtoto wangu akuli mboga. But technically, you're the parent, you're the grown-up, you're the one who knows, and you know that my child needs to give this, yeah? Put your ground rules down, be nice and firm, and make sure your child eats well, yeah? Make eating fun, and eat also around them, yeah? So that they also know that everyone is also enjoying this meal. Good nutrition is very key for growing and also for boosting immunity. So it's very important.
Okay.
Another thing for the babies, 2 to 6-year-olds, playing. Let children play. You know, it's an age group where, one, it's very tricky. Their 2-year-olds are now learning the environment. They're learning to move. They're more steady when they're walking. They're learning to jump and things like that, and they're exploring. And it doesn't get any better. It actually gets worse as they grow older. Allow your children to play, yeah? We have a tendency also to kind of babysit our children with technology. And you find that really, it actually interferes with their brain development. At this point, the brain is what we say very plastic. It can adapt to quite a number of things. It can learn many things. And children between 2 to 6 years learn a lot from the environment, you know. You go outside, the sun is bright, the skies are blue. You've taught them day and night. You've taught them color. In just a few seconds, you know, they go, they see these trees, yeah? They learn that the leaves are this color. They are smooth. There's a rough leaf. There's a thorn there. They learn a lot from the environment. So let your children play. Okay. Actually, it's recommended that children have a minimum of 180 minutes of play. Out of that, let 1 hour be vigorous play, yeah? But it doesn't mean you have to seclude it to that 180 hours. Let them play. They learn a lot from that, yeah? Then these are children who thrive a lot from affection and, you know, being recognized, yeah? So talk to your children, yeah? A lot of times, you know, sometimes you feel like a baby is small. Ataelewa nini nikumuongelesha, you know? But these children, first the 2-year-old is at the point where they're learning language. They can speak longer sentences. They have put multiple words together to get longer sentences. They can understand as much as they are not very expressive, they can understand. The 3-year-old gets better, gets more fluent. The 6-year-old will even question you, you know. Yeah. They'll ask you, why are you doing this? Because that's the point where now they're learning how to reason. So talk to your children. Okay. We tend to delegate a lot of our parenting to other people, the screens, the nannies, the teachers. But then as a parent, you also have to make sure, how is my child developing? So you have to talk to your children, play with them, engage them in whatever little thing that may seem silly to you as a parent, but is very important for them. That bonding is really fantastic for them, for their emotional growth, for their social development. Let them play with other children. They learn how to, share, play with others, little things from that. Yeah. So there's quite a number of important things that we need for our children.
Okay. So when we talk of grooming, there's something that you've mentioned that is really, really important because a 2 to 6 year old, this is a time that they're picking things from the environment they are at. This is a time that they're also growing into learning some of the things that you teach them as a parent. So as a parent, what are some of the conversations that I need to have with my 2 to 6 year old?
Start with the basics. Parenting, well, it can be complex. That's what most people say. But just do what you can. Walk in. How was your day? And well, the little babies are not very expressive. Yeah. So when you ask such a question, typical answer is good. Yeah, because maybe that's how they know how to answer. But now make it more involving. Yeah, ask them, what made you happy? What made you sad? What was good about this day? Did you play with someone? Which game did you play? And just strike a conversation with that child. It doesn't matter how young they are. They actually understand what you're saying and they understand the conversation. For the younger children, entertain their talk. It's a lot of bubble, it's a lot of stories, but that focus, that attention from the parent actually makes them understand that somebody believes in me, somebody is understanding me, somebody is giving me that attention. And without actually knowing what the parent is doing, they're raising a very confident child who will not be afraid of walking up and saying, I have a problem, can you help me with this? Because you gave them that opportunity when they came to you to tell you, look at my ball, it broke or something like that, and you listened to the story and you entertained it, yeah? So general conversation. A number of us, I'm a working mom, so you find that you might not have that time every day, but spare a few minutes once you get home. You can decide maybe if the children shower in the evening and I get home at that time, let me be the one to shower them and just engage them while we're, cleaning the babies, ask them different stories. And you find that in that conversation, you pick out a lot of things that's happening with your child everywhere. You might find maybe somebody is bullying them. You might find that maybe they enjoy this more than this. You might see their character developing. So it's a very important thing, yeah. It seems trivial, but let me tell you, even 5 minutes of your time without interruption for your baby makes a very big difference in terms of their interaction with you and their development later on.
Okay.
Yeah.
And what is an alternative for a parent, let's say, who cannot afford a pediatrician?
Okay. When we're going through med school, we go through stages. Before I became a pediatrician, I was in medical school for about 5 years then. Now it has changed. And we learn everything. We learn everything. Then you do your internship here where you're now a general doctor. And then after that, I decided now I don't want to handle anyone but the children, and I went in and specialized. So if you're not able to see me and you walk into any facility and you find a general doctor, it's someone who's well versed with pediatrics. They can still be able to pick a few things, yeah? You can walk into a health center, you might find a nurse who is able to show you something about your baby, teach you something. You can walk maybe into a dispensary and find a clinical officer who's also trained in a little bit of pediatrics. And all these cadres know that when they pick something that is beyond their expertise, then they know to refer. So being unable to afford a pediatrician does not mean that your child should not be able to get what they need in terms of medical care from a specialist. And we have pediatricians everywhere. I work at Mama Lucy Kibaki Hospital. It's a government facility. I'm a pediatrician. So you find that the rates there are subsidized, and you'll still be able to go in and see a specialist. So it should not stop anybody from seeking help when they actually need it.
Okay.
Yeah.
So earlier you stated that we're in a generation whereby our kids are raised by technology.
Yes.
Technology takes the the bigger part of it, sorry.
Mhm.
So most kids are also raised by nannies and house girls.
Yeah.
Is it something that you will recommend as a pediatrician?
If you have to do it as a working mom, and if you need help whenever you need help to raise your children, by all means get it. Because it doesn't mean that you're less of a parent for asking for help. Yeah. Now, what ideally you need to do is find somebody who's aligned to your values. Yeah, as a parent, and you train them as well into what you require for your child, so that this is basically a co-parent. When you're away, then they are helping take care, and you find that it's not anything new. It's just that it is now becoming more common. But if you look at even how our parents were raised, there was always either an auntie or a grandmother or somebody else when their mom or their dad had to be away from them. Yeah, so it's literally a village, and parenting is not something very easy, and it's not something you can do alone. Yeah, you need that village. So it doesn't mean that having a nanny makes it a bad thing. Yeah, but just make sure that whatever it is that you require of your child is also being passed on, so there's some kind of continuity of care. Yeah.
Okay. And
Mhm.
what are other measures that I can put in place to ensure that when I'm not around, my kid is taken care of the right way?
The right way.
Yes.
Okay. One, like I said, whoever you have within your reach, whoever is what you can say your village, whether it's your siblings, your aunties, whoever, let them know what your principle are as a parent. Sometimes there's a fear that maybe somebody is older than me, and it will be difficult to tell them I want this done or I don't want this done. But just let them know what it is that you want. Yeah.
Okay.
Then for those who you can train, like your nannies, train them. Yeah. Something from as simple as this is how baby's food needs to be cooked. This is the timings that we need to keep for nap times, for feedings, for playing, or whatever it is. This is how I want, this and this done. Make it trained, yeah? But the delegation just means that you're allowing somebody else to carry on your job, but it doesn't mean that you've handed it over, okay? So you as a parent then needs to come back and make sure that the rules that you've kind of set are being followed. So simple check-ins, like what I was saying, at the end of the day, have conversations with your children, just look around, how are they doing? Find out even from the nannies, whoever was there, what was happening. Was it a good day? You can ask them to call you during the day if you must, yeah. You can do frequent check-ins, phone calls to the kids if they can talk. These days, most people have smartphones. You can do video calls. So as much as we're kind of against technology, you can find ways to use it for your benefit, yeah, as long as you're not overdoing it, yeah.
Yeah.
So remember, you're delegating, you're not handing over the job.
Okay.
Baby is still yours. You still have to take care of the baby.
Yeah.
Yeah.
And you also talked about this is the age that you're also figuring out taking your kid to school. So at what age is my kid not prone to respiratory diseases to ascertain them be able to start school?
Okay, that's quite an important question, yeah, because you find that the babies are the ones who are most prone to illnesses, yeah?
Yeah.
A simple fact, their immune system is not very well developed, yeah? And that's one of the reasons actually we give them their vaccines when they're younger. And it actually gets worse. The more they're exposed to some of these respiratory illnesses, it gets worse. But that helps their immune system actually build up. So it's usually a fear that I know my child has to go to school and I'm afraid of them getting ill. But remember the basics that we laid down, yeah? Good nutrition, adequate sleep, which also helps, with that, and just follow up care with your doctor. And it's also important that when you have a sick child, that you're able to identify early. And the only way you'll identify early is if you keep going for your hospital visits.
Yes.
Because in those setups, we tend to teach moms and dads and caregivers. This is what a sick child looks like. This is what I need you to bring the child to hospital for, So they are taught how to identify a sick child and seek health care early. It's much easier even on the doctor to treat a child who has presented early than a child who's very sick, yeah?
Okay.
So take the children to school at the recommended age. For Kenya, it's 4 years to start their preschool. Some take their children earlier. It might depend on your circumstance or circumstances around work, but at reliable age is 4 years. Take them to school. Take all precautions. When COVID came, it taught us quite a number of things. It was like a blessing in disguise, because those are the same things that we actually use, and it's what we teach people on how to prevent simple illnesses like the respiratory illnesses and the diarrheas and vomitings and things like those basic hygiene. Wash your hands, keep surfaces clean, like if you're sneezing, coughing, and you can actually teach a child 3-4 years old how to cough appropriately, how to sneeze appropriately. Yeah. So just follow the preventive strategies, and if in any point the baby gets sick, take to hospital, and now we manage the baby. So don't be afraid of taking the babies to school.
Okay.
Yes.
Now that you've talked of taking your kid to the hospital, what are some of the symptoms that I need to be on the lookout for before taking my kid to the hospital?
Okay. Like I said, children don't lie.
Yeah.
A sick child will tell you, I am sick, in whatever way they will show you, but because you have stayed with this child, you will know there's something wrong.
Yeah.
Majority of the time, it will be just a change in mood. My child is usually very playful. All of a sudden, we're not playful. My child eats very well. All of a sudden, I don't want to eat food. Yeah, those ones on top of maybe the obvious signs that you'll see, like maybe they're coughing, or maybe they're having diarrhea, or maybe they're vomiting, or on top of the extra things. But the simple things, just look. Is there any character change? Then there could be something wrong. Monitor, put your eyes on it and see, is there a problem? Do I need to seek medical attention? And if you're not sure, I always say you'd rather go and let a professional tell you your child is okay, monitor, than sit in the house and decide, no, I'll just watch. You might just watch until things are really thick, and at that point, managing is difficult. So if you're in doubt, just take the child to the hospital. Yeah, that's what we're there for.
Okay.
Yeah, we examine the baby and we say, okay, there could be something small, do this and this and this, or take this medication, or follow this up. And at that point then, I pick it as a moment of education. And I tell you, if this gets worse, these are the danger signs to look out for, yeah?
Yeah.
Okay.
That is a very important note you've put out there. And I also want to ask a follow-up on that, because in an African setup, basically, when a kid is sick, sema mtoto ako na homa, we always know a particular medicine for a particular disease. So would you say we are a generation that is over-reliant on drugs?
I think a lot of what comes up in terms of how you manage your household is from also what you see other people doing. So you'll say, maybe when I was being raised by my mom or my dad, every time I got sick, I was given Piriton and I was fine, yeah? Or I saw my grandmother or my mother was managed like this by my grandmother, or I've seen my neighbors doing this, yeah? So it comes from what you have observed, yeah? But that's now where we come in and we say, just seek medical attention. You'd rather get the right information from somebody who's gone to school and studied all of this, yeah? Than from somebody who maybe would think it's right. And you'll find a number of times we don't even manage those illnesses with those medicines. A number of times people will come to the hospital and I send them back home and they're like, daktari, wapi daktari? I mean, wapi dawa? And I say, you don't need dawa. This is the situation, yeah? So treatment also is not equals to giving medication, yeah? But that is now where we come in, and that is where such forums like this are important, because we are telling people, don't do trial and error at home. Go to a healthcare professional, go to your pediatrician, let them be the ones to tell you, I think you can survive at home with this and this and this management, but watch out for this.
Okay. And how do you make a parent certain that the kid really doesn't need drugs? Because when you mesema, mzazi anakuuliza wapi dawa ya mtoto, how do you make it out there for them to understand that it is not drug that they need for that child?
In fact, a number of the times when you come to the pediatrician's office, it's like more counseling for the parent. Like a small portion of it is managing the baby, and then the rest of it is just reassuring the parent, yeah? So, and education is very important. And lack of knowledge actually is what drives us to do some things, yeah? So, if you meet me, for example, and your child has a homa, in the simplest terms, I will explain to you what it is, what causes it, what symptoms happen, why you're seeing this happening now, how long it will kind of take, because like a homa, for example, is a viral illness that will, the body will kind of sort itself out. Now we have to like support the body, yeah? And a number of the times, once that conversation is over, the parent is like, okay, I think I'll do what you say. You know, even if they're like, no, so, they're like, okay, I understand why. Yeah. And then I always follow it up with, if things don't get better, rush back to the hospital.
Okay.
Yeah.
Okay. Thank you so much for that. Let's get to the comments. Well, thank you guys. I'm really loving this conversation. I'm learning. I'm really happy, as you can see. I'm learning new things, and I'm hoping you guys are also getting the same vibe. So, Ian Short it. Thank you so much for staying tuned for Island's expressions. I'm a Tuma Fire. Thank you so much. We send back the fire back to you, Yari. Thank you so much. Sherry Mercedes. Hi, Sherry. Thank you so much for joining us for E Squared. Amesema moto. Sherry. So thank you so much for joining the family. So I'll just need you to do one thing for me. Subscribe. Subscribe to our channel. Turn the notification bell on, so next week tukiwa na show hautamiss. Across the week tukiweka content kwa page yetu hautamiss. Situko sawa, Sherry? And thank you so much for joining us. Rebecca Muiruri. Hi, Rebecca. Rebecca anasema yay, girl power. Happy Women's Day, Rebecca. Lucy Naima anasema learning so much. Good job. Thank you so much, Lucy. Lucy, subscribe to our channel. Turn the notification bell on. Keep sending us the love, yes? Steve Biko anasema ndio kuingia sasa. Karibu sana Bazoo. Karibu. Steve Biko. Ian Short amesema akona question hapa, anasema most children between the age of 3 to 6 years old don't like eating. How do you make sure they eat properly?
Okay, that's a very important question. And it's actually a very common question. And it doesn't only happen from 3. It actually even sometimes happens earlier. Mm-hmm. Now, same thing I said, good spacing every 3 hours. It's important to note actually that babies, their tummies are small and they fill up with very little. So if I give you a glass of milk at 1 o'clock and I put for you ugali at 2 o'clock, the child is not going to eat. So if you have good spacings, 3 main meals, snacks in between. Remember, the snack is only supposed to carry you on to your next main meal. Yeah. So it's not food. It's not like a whole other meal, yeah? Make your food interesting, yeah? So give variety. Don't give the baby ugali and eggs every day. They'll get bored. Even you as an adult, you'll get bored. Yeah, yeah. And then it's important to know also that babies have small stomachs. And a number of times, what I get from parents as the child not eating is that they're not finishing their food. Mm-hmm. And when we get the history, the child has been put for so much food, honestly. They won't finish. So start with small quantities, yeah? Each a fist. You see your fist? Yeah, hold it like this. So now imagine for a baby. Then 3 of those, like protein. So that's kidogo. Okay. And then now you keep adding. But remember, it's a balanced meal, yeah? Yeah. Interact with the child as they're eating. Don't make mealtime a stressful environment, because now they associate it with that. So if kula, maliza chakula, money, everyone goes like, over here, it's time to eat, time to throw a tantrum. Because they're already apprehensive. They're already waiting for drama, yeah? Okay. So eat with everybody. Let them see that everyone actually also does this. And then small different meals, and then a variety of meals. They'll get some food aversions as they grow older. But just keep it consistent as the parent. And then when you go to your clinics, that's another thing that we check, because most of those who have problems with eating, you look at their weight and their height, and the child is actually thriving. So it's also for the parent to understand what eating and not eating is, which also comes from regular follow-ups. Yeah, it's important to note that children, as they're growing up, they build up they require a lot of protein to build up, because they have rapid growth and they require quite a bit of protein, yeah? And a number of times you find that is what culturally maybe kids are not supposed to eat. You'll hear someone saying a child is not supposed to eat eggs or meat or things like that, but that is what they need, yeah? So balanced, I can't emphasize on balanced diet. And the mbogas must be there. The mbogas must be there.
Yes, Mort Lizzie. Hi Mort, thank you so much for joining us live. Ametutumia moto. Thank you so much. Japheth Kalombo. Hi, Japheth. Ametutumia moto pia. Thank you so much for joining us for Eastlands Expressions. We come live to you each and every Saturday from 2 p.m. So just subscribe and you'll be part of the next conversation. Hi, Michael Black. Michael Black ametuma question hapa anasema most kids start school and have flu throughout and you can't keep medicating. What should parents do to manage the constant flu?
Okay, so like I mentioned earlier, management of illnesses is multiple, you use multiple aspects, yeah? So one, prevent, and then two, treat, yeah? So in terms of prevention, nutrition, like I said, good balanced diet, make sure their weight is good for their age. We also have vaccines for flu. And also you find that what we call flu is sometimes not flu. It's actually a common cold, yeah? But just there's a yearly vaccine that we give for the flu vaccine, which is also very important. It's not in the what we call the KEPI schedule, but it's an important vaccine. So let them get their annual flu, let them hydrate well, let them eat a balanced diet, fruits and mboga kwa wingi. I keep talking about mboga. And then build also their physical strength. That also helps, yeah? And then when the symptom, and then basic hygiene, yeah? Hand washing, and children can be taught how to do that, yeah? Hand washing at every instant, especially when they are ill, yeah? And then once they get ill, early identification of the symptoms and management. So it's not uncommon because the immune system is still kind of sorting itself out, yeah? But it's a very difficult period for most children, especially when you start school, like those who start school at 3. And you find but by the time that they're 5, 6, their illnesses are way less. In fact, the 6-year-olds don't get as sick as the younger babies less than 5 years old, yeah? So just to encourage parents that it's a season, but if they follow the instructions put out to them, then it's manageable.
Okay.
Yeah.
Other than common cold, are there other diseases that have symptoms like flu-like symptoms?
Well, a number do. And you find that even children, the way their immune system is, they might actually have something and not present the way you typically expect. I might have a chest infection and I'll vomit, you know. I might have an infection, you know, like in my nose, and I'll probably have diarrhea or something like that, yeah? So just to identify that this is out of the norm, yeah? They're very prone to quite a number of illnesses, yeah? And a number of them you'll see, like I said, we prevent and we manage. A number of them you'll see that we prevent when we're giving you vaccines, yeah? Which will help you get maybe a less critical version of the illness, yeah? Sometimes it will not stop the illness completely, but you will get like a less severe version of the illness. So make sure your children get all their vaccines, all the ones that are recommended and the add-on ones if you can, yeah? And then just the other things, yeah.
Okay, thank you so much for that. Acheng Okelo, okay, Nancy Bansi first. Hi Nancy, Nancy anasema, how can you tell if your kid is experiencing abuse?
That requires a very keen eye. But remember, like I said, children don't lie.
Yeah.
They will show some symptoms somewhere. So one, as the parent, check in with your child. Check in with your child. And when you check in with your child, then you're creating a situation that's comfortable enough for them to talk to you, yeah? So do frequent, like when they're younger, frequent check-ins, just watch the baby, find out, talk to them, you know, things like that, yeah? Look for any signs that are not usual. Like my child was always happy and laughing, now they're a little bit withdrawn. There's something a bit off, yeah? If you're keen, you will see it, yeah? And then also, to prevent it, remember knowledge is power, and knowledge is power for everybody. Even the child that you think does not understand, understands very well. So when they get to about 3, 4 years, they actually get quite interested in their genitals. It's not unusual. They actually start learning that I am a boy, I am a girl, boys look like this, girls look like this, boys are supposed to do this, girls are supposed to do this. And then so when you see such kind of interest, you as a parent also introduce the topic of good touch, bad touch, yeah?
Okay.
So that they know, I think someone touched me like this. Even a 3-year-old will be able to tell you, when I was being showered, auntie did this, you know, because you've started the conversation. Make it more and more complex as they grow older. With a 6-year-old, you'll give in more detail, you know, you'll talk about private parts using their names, real names, not Susu and Dudu and things like those, yeah? So that then they're also aware. Empower your child, yeah? Okay, and frequent check-ins. I can't emphasize the frequent check-ins.
Okay. Office, wow. Hi, Achieng Okelo Abungu Omondi. Thank you so much for joining us for E Squared. Hey, uko na jina poa sana. Anasema Kongole BFF. Dr. Atieno Joey Semo. Makofi, amazing stuff. Asante sana kwa kutujoin. Makenda TV, thank you so much for staying tuned again for E Squared. Anasema my baby has a shilingi. Kwa hiyo place nywele na katika. What will be the problem, doctor? Shilingi uletwa na nini?
Shilingi is what we call ringworms. It's a fungal infection, yeah? Now, just from the description, it's very difficult to know what it is because there are a number of skin issues that look like this shilingi. And we also have a tendency as our society to go to a chemist and say, "Mtoto wangu ako na hii," then you're given medicine, and it might not actually be that. So if it is something that's persistent, I would strongly advise that she gets it checked out. It might actually even be eczema, it might be something else, yeah? It might not be what she thinks it is, yeah? But if somebody looks at it, they'll be able to see what it is, and then they'll be able to advise further. Yeah.
Okay. Okay, thank you so much for that. Michael Black ametuma comment anasema, what is the difference between flu and common cold? I thought they're the same.
No, a flu is actually called by what we call influenza. It's a different type of virus, yeah? A common cold have multiple other viral causes. There are so many viruses in this world, many, yeah? But what we call the flu is typically caused by the virus that we call influenza. Yeah, sometimes quite serious, and it's what actually you're given as the yearly flu shot. It's an influenza vaccine. There are many strains in that, yeah? So we typically use the word interchangeably, but what most of the time we experience is the common cold. Yeah.
Okay. Thank you so much for joining us for this conversation. I have learned so much. Thank you so much for creating your time. But before I let you go, you are a mom. You
Yes,
said
I
you
am.
are a mom.
Yes.
So as a mother, Dr. Elizabeth, what are some of the lessons you have learned in between?
Okay. One, it's important to know that I was also very clueless. And I would call people. I'd call my mom on the phone and say, "This is happening." And she says, "But you're a doctor." But literally, being a mother makes it very different, yeah? So there are those things that you will typically not know, and you're also learning. It's a full-time job. It's nothing you've ever been prepared of. Each child is completely different, even if you have multiple children. So you're literally learning along the way. So being a doctor doesn't stop you from not knowing some things. And actually being a mom who's a pediatrician, there's lots of comments you get, like, you just treat your child. When my child is sick, medicine goes out the window. I become a mother.
Yeah.
I need to know what's happening. So my children actually have their own doctor who I take them to and when there's an issue, yeah? And yeah, but you find that being a doctor and a pediatrician and a mother, it kind of has opened my eyes to quite a number of things. And I think it has made me maybe even more keen that if I see just something happening, and I'll even ask the mom, "Have you also noticed this?" Because it's like I'm kind of putting both maternal and medical knowledge together, yeah? So I think it has actually made me more keen. It has made me more empathetic to moms who have sick children. I have had sick children, and it really drains you. So, and you find yourself in a situation where you're telling the mom, "Why didn't you do this?" But at that point, they're a mom. They were traumatized, yeah? So it has made me more empathetic to mothers with sick children, yeah? And I think overall it has made me generally a better person, a more patient kwanza, more patient person even, yeah?
Okay.
Yeah.
Okay. We also have Makenda amejibu tena. Makenda TV anasema hiyo shilingi inaweza kosiwa na lack of deworming. Anauliza kama lack of deworming can cause that shilingi.
I think it's kind of a myth that we have that if I have worms, then I'll have mashilingi. Well, if you have worms, then remember, like in layman's language, these extra things are actually eating what you're supposed to be taking. So there'll be an element of undernutrition or something like that, especially if they're more, yeah? So, but it doesn't always cause the skin issue. It's a fungal infection, and it's very contagious. So it could be that maybe somebody in the school or at the barber shop, and maybe the tools weren't cleaned very well, and you got infected. But if your immune system is not good and your nutrition is also not good, then it means then you're at more risk of getting some of this, what we call common illnesses. Yeah.
Okay.
Yeah.
Asante sana. Hey, umetupatia free lessons, and guys, you get to learn all this stuff each and every Saturday from 2 p.m.